So we have followed patients from the initial early acute back pain, for example, up to 3 years later, and we have scanned their brains many, many times, and we can see the evolution of those changes. So those are the consequences of the development of chronic pain, right? How the brain is changing, and we have shown that both the brain anatomy and the brain physiology are changing. What do I mean by the brain anatomy changing? What does that mean? That's a kind of a strange idea, right? The brain anatomy means that, in fact, we think that the specific connections of different areas of the brain with each other, the synapses, we all know what a synapse is. A synapse is the information coming from one neuron into another neuron, the information transmission from one neuron to another neuron. It's the fundamental unit with which the brain does any calculation, any perception. And so those properties, if they change, we can see them grossly by very poor sort of imaging, looking at the size and the density of the brain locally, and those things are reflecting how the information exchange is shifting in the brain. And again, then we can look at those areas in animal models and actually specify what synapses and how they are changing. But in some ways, it's trivial. In retrospect, most of science is trivial. But until we have the proof, we can only dream about them. In a sense, one could simply think that when you have chronic pain, you're suffering, you don't like it, you are trying to cope with it, and so every day a person wakes up and the pain is still there. How do you deal with it? So just the behavioral adaptations that people have to do to deal with their pain itself is going to reorganize the brain. In a very simple way, the fact that you and I are talking, our brains have changed. They have changed because our memories have changed, our experience has changed, and some synapse somewhere, a few synapses in the brain have changed. But that's very small, and it's impossible to find in this everyday behavior. On the other hand, when you have a condition that's persistent, that's consistently debilitating, then it has much larger effect on the brain. It's affecting many areas of the brain and different areas of the brain in different ways. And so as a result, we can identify them. Now then the question becomes, what are they reflecting? Is it just the coping? Is it the suffering? Is it the risk? How do we sort of dissociate them from each other?